my name is Dr. Shobna Singh and I work at Nitai Medical and Cosmetic Centre. We'll be showing you a consultation with a patient, and we'll show you how we treat frown lines and tear troughs. The consultation will be with a patient in her late 40s, and she'll be describing what her main concerns are, and we'll do a demonstration of the actual treatment as well. Hi Vita, how are you today?
Good, thank you. How are you?
Good, thank you. Now you're here about some treatment for your face today?
Yes, I've been a little bit concerned with my skin and the way I look at the moment. I've been looking at photos of myself and I've noticed over the years that I've aged a little bit, and I'm not really sure exactly what I should do with my face, but my main concerns are really under my eye area. I just found that it looks a little bit sad and tired looking at the moment. I've also got a scar in the middle of my eyebrow, which is like in the frown line. I have had Botox on the side of like my crow's feet around this area over the past, probably the last month, and I found that's been really good. I've been really happy with that. And if there's anything else that you think I should have done, I'm happy to take your advice. Looking at other areas as well in the future, if you think that I should have, as I'm heading towards 50, I'd like to sort of do it slowly, not look too different, but a little bit fresher.
So what you've described is very natural for someone in their late 40s, and most people that come in are always concerned, not necessarily about looking younger, but the main concern is they're actually looking sad or tired or just not as fresh. So you could have a really good night's sleep and people say, why are you so tired? And it's really kind of off-putting. So with some of the treatments that we do here, such as the anti-wrinkle injections and the dermal fillers, there's a lot of laser treatments as well. It just refreshes the face, so you'll still look like yourself, but you just look like a fresher version. And you know, people think if you had your hair done or you've just stopped off a cruise, you know, it's just something, but they can't really put their finger on what's actually happened to you. With the tear trough area, which I agree, I think is probably the main concern. I'll show you a photo of you. So I'll take a photo of you with no expression, just looking very sullen, and that'll give you an idea of what your main concerns are. Sometimes you don't really see it in the mirror, but you seem to know exactly what you're worried about, which is spot on. Okay, so this is a picture of you with no expression.
Yeah.
So what do you see? You can actually draw with your finger like that.
Oh, okay.
So
that's
you can
excellent.
actually show us what you're concerned about.
Yeah, it is mainly this area here. As you can see, like that hollow sort of look, and also my cheek. I've noticed in a lot of my photos, the ball of my cheek is like this bit's flat, so I don't know if that's all connected. I'm not sure if that bit there is all what you feel, I don't know. But and also this, as obviously you can see my scar.
Cheek area, we tend to use a fairly good filler which tends to last about 18 to 24 months, and it's very good at volumizing and tends to be quite easy to work with, so it gives a nice smooth finish. So when someone looks at you, they won't know there's anything in your actual cheek, and it assimilates really well. So it looks smooth and very elegant. And in the tear trough area, we use a softer filler, which will last about 12 months, and that again gives a really nice smooth finish. Because the whole idea is that you have products put in your face, but it's not visible to anybody else. It's just about lifting.
I want it to be like a little bit. Not as obvious, but just look, just to look fresh and
So eyes are a really nice feature of your face, so it would be nice to draw some attention to it and make it look nice and fresh in that area. The scar that you've got in there, that actually can be treated with the same filler, and that'll, you know, won't actually necessarily take it away straight completely, but it'll look a lot better.
There was also another area that I was looking at. I'm not sure about whether there's anything else that you're wanting to look at, but is there anything that you think that I should have done?
So when we analyse somebody's face, we usually divide it up into thirds. So we've got the upper third, middle third, and then the lower third. So I think the main area that you're aging fast is probably around the eye area in the mid-face. But later on we can look at possibly treating the lower third just to enhance your beauty a little bit more. So if you have a look at the corners of your mouth, you can see a little bit of a drop. And that we call it the mouth frown. And if you put a little bit of filler, which is the same filler that we use in the cheek area, it gives it a bit of lift and it's more neutral. So the mouth's not pointing down and making it look sad. And that looks quite elegant as well when it's done.
Sounds good.
Now with your lips, you've actually got a really nice, you know, the lips have a very, very nice shape, but you can also enhance it a little bit with some filler, but without it looking false or artificial. I find a lot of women are very scared when it comes to lips, because you see, sometimes you see people that are overdone. So it's really just designed to be subtle.
If you think that I need it, I'm happy to go with your advice and whatever you know, can
And
improve.
with your frown, you're not interested in treating your frown lines?
I'm just a little bit funny with stopping me from using my expressions too much, and only because I think I talk a lot with expression. So that's the only thing that I'm thinking, if it'll stop that. But if you think that it'll be...
It might be worth considering maybe doing it once and then you can see the results. Because one of the benefits of treating that frown is the skin actually looks a lot better in that area. It elevates the brow.
Yeah, and as long as it lifts, because I've noticed how it droops a little bit. I'm concerned about the drooping, because in a lot of the photos when I was younger, I didn't have that as much, obviously, because that's part of ageing. Obviously, your eyes do droop. And this is the part that I always find, it makes me look sad.
So when we're addressing the brow, one of the things we can do is actually just inject it laterally. There's a muscle there which actually pulls the brow down. So if we inject that muscle, you'll find that with some anti-wrinkle injection, you'll find that'll elevate a little bit.
Yeah.
And with the more medial part of the brow, when we treat the frown lines, you find there's less pulling down. And I can show you pictures of patients that are treated, and you see quite a nice result. And I understand your concerns, but sometimes it's worth giving it a go, because the anti-wrinkle injections last you about 3 to 4 months. So if you don't like it, you don't have to do it in the future, but at least you'll know then whether it's for you or not.
Yeah, that's true. All right. Oh, we'll see how I go. I might try it, and I suppose it's not like it's forever, so
yes.
I don't like it.
And the other good thing about the fillers is that they're reversible. We can actually use a product to, if for some reason there's any issues, we can actually redress the product.
I don't like it if it's too much for me, and I know what you mean. Yeah. All right, that sounds great.